Welcome back to Be Well as we continue our month-long series about breast cancer.
For some women, their diagnosis goes beyond their breast. Just last week, I spoke with an oncologist at Stony Brook Cancer Center about how and why that cancer can spread.
I had an aunt, she had breast cancer, and then she got bone cancer, and then she got brain cancer and liver cancer. So the reality is that in all likelihood, that aunt probably just had breast cancer.
Dr. Alexander Stessin is a radiation oncologist at Stony Brook Medicine.
The key is that this is not brain cancer, this is still breast cancer, right? Even though it goes to the brain, it's still called breast cancer. It's still the same cancer, but now growing in a different spot. There are two main ways that cancers can spread, through the lymphatic system, right, through the lymph nodes, and through the bloodstream. And once it's in the bloodstream, it can pretty much go anywhere. The brain is a little bit special because there are a lot of medicines that will work on other parts of the body that won't get into the brain because of what's called the blood-brain barrier. The mainstay therapies for breast cancer or any other cancer that's spread to the brain are really surgery and radiation. The goal of radiation oncologists is to plan the radiation treatment in such a way as to minimize the dose of radiation and the damage to normal healthy tissue. Radiation has evolved a lot over the past several decades. The patients lie on this treatment table, and there's usually an immobilization device. This goes over the patient's face, and this is what makes the treatment very conformal and very targeted. Treatment of breast cancer is a multidisciplinary effort. Each of us contributes his part or her part. For each patient, we basically develop a plan together.
The higher the stage, the higher the risk for recurrence and spread of the disease. And then we tailor our treatments based on the stage of the disease. One of the goals is to cure the patient of their cancer. Then we try to keep patients alive as long as possible, and we try to maintain their quality of life as best as possible.
And it is so incredible that when it's in your brain, it's still breast cancer.
Yeah, fascinating stuff there.
Right?